Good evening, everyone. This is Kevin Rollins. I'm doing my presentation on good health for advanced leadership here with Professor LeMasters. We're going to get into it here. Okay, everyone. We're going to start by defining what good health actually could be. Schramm in 2023 defines health through a clinical definition as the absence of disease. This is generally what we think of in a medical sense as a healthy individual. In 2016, Erdman defined good health is not only a physically healthier life, but also a more meaningful and impactful life. So this goes on above physical health. This also gets us to do better mentally and spiritually as well. And finally, what is self-care? Self-care, defined by the World Health Organization, is the ability of individuals, families, and communities to promote and maintain their own health, prevent diseases, and cope with illness with or without the support of health or a care worker. So self-care is someone taking their own initiatives and dealing with their health in their own way. To elaborate a little bit more on Schramm's definition of health from 2023, he defines health, or describes it rather, like virtues. Virtues describe human excellences. He compares virtues or excellences of character or perfect dispositions to act fully adequate to health in relation to well-being, or perfect organic disposition to keep harmful and disadvantageous conditions at bay. What this does is this elicits the populace to press forward and to continue the sojourn for health promotion and the infinite attempt to obtain health. Down here to the left corner for mine workers and millionaires, Schramm uses the comparison of miners and millionaires in his argument about health. Mine workers have a tendency to be frailer because of body stress and adverse working conditions, yet they can be, by definition, healthy. By comparison, the easier life of the millionaire can be misjudged as healthier simply due to circumstances of life. To me, this puts a great comparison, in fact, the way you live your own life and how you control your own health adds to take away external or environmental problems that could be detrimental to your health. Throughout his report, Schramm's thoughts on health is a preference for holistic health outlook over a perceived World Health Organization prescribed perfect health. Holistic health aligns better with Erdman's definition of good health. By pursuing holistic health, per Schramm, we can find health promotion initiatives, preventative care, and equitable health policies that address population health equally. Next up here, we have the World Health Organization's definition of self-care. The World Health Organization in 2026 Their interventions include healthy practices, habits, and lifestyle choices, such as eating a healthy diet, being physically active, refraining from tobacco, avoiding alcohol, enough sleep, and meaningful connections with others. Self care, per the World Health Organization, is people acting as active agents in managing their own health care, being more apt to want to learn about their disease cases, um, being more advantageous with their treatment options, things like this. Of course, for personal choices, we have autonomy. The World Health Organization policies press for equality and justice, as described by Huckabee in our text, for all humanity regarding health. Everyone, regardless of race or economic conditions, can utilize self care in an effort to improve their own health literacy. And of course, autonomy per Huckabee should be granted for those attempting to utilize self care, and education should be provided without the imposition of our own personal will against that person. We need to give people their own information to let them make their own decisions without um, without forcing our thoughts and obligations onto them. And of course, protecting and supporting the rights of individuals is key to the personal exploration and initiation of self care practices. Okay, moving on here to personal health care. The apex goal, the main goal for personal health care that can be explained from the World Health Organization as a people centered approach to well being. Um, we touched on the definition of self care in the previous slide. We have a different definition from the World Health Organization in 2019. Self care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a healthcare worker or provider. This is important because underserved, um, more poor, desolate areas, um, think third world countries, they don't have a great deal of advanced healthcare, established healthcare. Um, so they have to deal with it, in their own villages, own towns. They have to go miles and miles out for health care. So they really have to deal with everything through more of a humanitarian approach. Okay. Next, we have restrictions of personal health. This is the barriers to personal health. Of course, we start with socioeconomic because, that is the area of which we live in. This could be lack of affordable health care, lack of ability to obtain insurances. This could be, people working under the table or, cash only jobs, do not have the ability to get health insurance through their workplace. And some do not have the ability to purchase like your Obamacare, things like that. Some people, and this goes in with personal barriers as well, they do not have adequate transportation. You can't get to work, you can't maintain work. Um, Additionally, you can't get from home to the welfare office to apply for state insurance, Medicare, Medicaid, things like that. Um, and in rare cases, sometimes you are working at a place that does not offer insurance, and your designated income is more or over that you can qualify for insurance through the state with. So you're in like that donut hole that just does not have coverage. Personal barriers that can include basic noncompliance. You have your people that do not want to, they just don't want to deal with their own health. That could be due to illiteracy, complexity, multiple comorbidities that make or exacerbate one problem over the other. That could be physical limitations, as you can't walk, you can't get down the steps of your house, to go to the doctor without, EMS or somebody helping you, carrying you down the steps. Health system barriers. This could be things like excessive out of pocket coinsurance, increasing medical debt. Um, you know, even for simple tests such as a ultrasound, that's almost $1,000 procedure. I personally know that because this week I had to go and get an abdominal ultrasound and they showed me a bill for $900. So I can understand that. Inability to obtain testing. This goes back to transportation issues. This could be also physical limitation issues. Also, inability to obtain prescriptions. Maybe you don't live near a pharmacy that offers prescription delivery to your home. Um, or you don't have transportation to get to the pharmacy, or you have to wait till the first of the month to pick up your medicines. Any of these reasons could be a restriction for your own personal health. Okay, next we have personal health personified. We were asked to use a well-known figure from history or current times to illustrate the goals of personal health care. And I thought there's not really anyone better than Jimmy Carter. Of course, he was our 39th president of the United States. Briefly, because I know most of us were born well after Jimmy Carter's time, um, but he, in his term as president, some of his accomplishments were the Panama Canal treaties, the Camp David Accords, Israeli Egyptian peace treaties, and he championed human rights. And of course, that's from the Carter Center um, from 2026. Great information there. Some of his personal health struggles. He, of course, as he got older, like many do, became more frail, had a lot of falls, multiple broken hips, things like that. Um, but with him, he had metastatic melanoma, skin cancer, that ended up coming with brain metastasis. He fought through this, of course, and utilizing new therapies, immunotherapies such as pembrolizumab or Keytruda. He was allowed and able to go into remission. Um, and he ended up living, not 100% on the time frame, but I want to think maybe 5 to 7 more years after that remission. Um, of course, he also championed Habitat for Humanity, which built homes for underprivileged families until his health rendered him unable to do so. Um, Further on, the Carter Center, his namesake, his legacy, if you will. It is a philanthropic adventure using President Jimmy Carter's name and his ideas. Quote, "We believe access to health care is a human right, especially among poor people afflicted with disease who are forgotten, ignored, and often without hope." End quote. Um, he utilizing the International Task Force for Disease Eradication, or ITFDE, through the Carter Center. They fight, most of these are more third world issues, um, but they fight diseases such as guinea worm disease, lymphatic filariasis, malaria, river blindness, schistosomiasis, and trachoma, while also supporting mental health, both here and abroad, um, and health caregivers. So the Carter Center does a lot with health promotion, trying to get rid of these diseases that cause all these issues for the people that really can't afford it. Next up, we're going to achieve our personal health care. And the way that we're going to do that is first with patient empowerment. This turns the power from the physician or the healthcare system, and this gives the power back to the patient to decide their health care. This is dependent rather on patient or family competency and allows them to utilize autonomy, or Huckabee, and make informed decisions regarding their self care. Of course, empowerment utilizes either legitimate or expert power that we learned earlier in this semester from Huckabee in our text. This is either learned, or this is power that is possessed by the patient. They have came up and learned this information, so now this is their expert power. Next, we have activation. Activation and empowerment kind of fall hand in hand. Hickman, Richter, and Schleider in 2022 says activation comes from the sense that the patient's attitude of readiness to engage in healthcare decisions. So we have empowered the patient. They have gotten their information. They're gaining up their expert power. And now they're activating. They're starting to use their power, and they're starting to make will of their own decisions. Next, we have enablement, and it says the sharing of information between the healthcare team and the patient. This is us providing them information on a disease, on a medication, on a treatment plan, XYZ, them taking their activation and their empowerment and them learning, hey, we want to do this instead of how you said this, that, and the other. So this is important as a back and forth to get information, good information to the people. And finally, engagement per Hickman, Richter, and Schleider. This is a multidisciplinary concept. Patient engagement, number one, is personalized interventions based on individual personalized needs. There's a lot of consonants in there, got tied up all over in that. So basically, this is patient specific problems and patient specific interventions. This is not cookie cutter. This is what the American Health Association says about your blood pressure. This is what the patient needs specifically. Number two, confidence of the patient to obtain their necessary resources. Um, Basically, with this, you can lead a horse to water, but you can't make it drink. The patient has to obtain their resources based on our recommendations and the healthcare provider, and the patient's plan. Three, patient willingness to participate. If the patient isn't going to participate, then self-care is not going to be a viable option. Again, you can lead a horse to water, but you cannot make them drink. We can give you all the information. We can tell you what you need to do, how you need to do it. But if the patient is not willing to, prescribe to that regimen or to go farther and, exceed that regimen, this is not going to work. And four, and most importantly, this is an alliance of the healthcare system and the patient. It's a symbiotic relationship. One can't really go without the other. Okay. Of course, we have to talk about the avoidances of personal health. This, again, comes from whether or not the patient is willing to manage their own self care. Um, Self care neglect by Guiler and Engine from 2023 is defined as an individual's not showing the necessary attention and care to his own care. Um, Basically, to me, that sounds like, for whatever reason, specified or not, um, the patient is not willing to, eat effectively. They're not dressed right. They're not. They're not willing to find. They're in subpar living conditions. They're not good with their money. They're not keeping money for their medicines or treatments or whatever. And of course, this increases the chances of morbidity and mortality. So, traits of personal health from the World Health Organization. Um, Obviously, physical traits: smoking and alcohol cessation, exercise, healthy diet, weight loss. On the mental side of things, stress abatement, you know, lessen the stress, lose the stressors. Sleep hygiene, very important. Positive personal connections, be that with family, friends, healthcare workers. Routine healthcare follow up also belongs in these personal health traits as well. Um, and basically, this all congeals together, and this personifies personalized health. I appreciate your listening. Thanks so much. References coming. Glad you stayed tuned.